Hey, thank you everybody for being here. I'm going to have well, listen to that. There's a little feedback there. Really happy to have everyone here tonight. This is a pretty special night for us because we're starting a new chapter in the history of living well today. We're talking about peptide therapy, and it somehow just fit into this model that we've been looking at for children with autism, for people with Alzheimer's or mild cognitive impairment. And so we're just very excited about having everybody here, but especially I'm very excited about having my new friend Blake. And Blake is from Tailor Made Pharmacy in Nicholasville, Kentucky. And he's going to inform us tonight a little bit about why these peptides became a very powerful treatment so rapidly here in the United States in the past. I don't know how many years, Blake, 5 years, 3 years, 7 years?
So we've been open just over 3 years here in the state.
So we're very excited about that idea, and somehow it just fit our model of what we call neuroimmune dysfunction. Now that's why we're about ready to publish a white paper on how neuroimmune dysfunction really works. And so we're very excited about having that in your hand. So text Aaron to find out how to get a hold of the white paper. We're not going to actually put it online just yet until it's reviewed and cited and vetted by other professionals. But the basic idea is that high concentrations of peptides, neurohormones, basically like oxytocin, and other cytokines and coenzymes like NAD are making a big difference in mild cognitive impairment. It's making a big difference in depression, and especially teen or 20s type depression. And we can't make any claims, but it's just making a big difference in people's lives. So we're very excited to have Blake here tonight. And Blake, why don't you start? Tell them about Nicholasville, Kentucky, and why the heck you're in Nicholasville, Kentucky.
Yeah, that's definitely a question that we get pretty frequently. So yeah, we're in Nicholasville, Kentucky, which is right outside of Lexington, Kentucky. So
they must have some horses or something over there.
Exactly. So that's kind of where why it came to Nicholasville, Kentucky, was we kind of anticipated these peptides being big in the equine business. There's a lot. So we have, the peptides started it over in Australia with our sister pharmacy, and they really took off over there. And they dealt with some horses over there, but also in Dubai. So we have a location in Dubai as well. So obviously another huge place for horse racing. So
and camel racing as well, right?
Camel racing, yeah, that's right. So whenever we decided to open up here in the States, one of our owners is from right here in Lexington, Kentucky, but also obviously the horse industry is what kind of piqued our interest. Little did we know, though, we ended up not really doing anything with the horses. We saw a much bigger need in humans, and that's where it all kind of started. We saw, it's the sick care model is kind of broken. It's just the traditional medicine, people taking meds and polypharmacy, and putting them on another med that causes them to put on another med, and with the peptides. For a lot of people, it's, you can, kind of catch a lot of these things before, they really get too bad or,
I really like talking about chronic wellness rather than chronic illness. So right. I'd like to have some chronic wellness for a change.
Exactly.
So we serve a lot of people who are very compromised. They've been through Lyme, they've vector-borne infections, so we just won't even call it Lyme. Vector-borne infections, mild cognitive impairment, just a lot of things going on in this world today. How does a peptide really work to help us from that? And you taught me that. So the reason I have Blake on is because he taught me about everything I know about peptides at this point. So tell me why they're important in the recovery of, everybody thinks, if I take a peptide, I might get less of these things around my eyes, but it's not really about that, is it?
Right. Yeah, I mean, so that's kind of one of the nice things with peptides are there's so many out there and so many new ones coming out every day. But there's really a peptide out there for any and every condition. But the nice thing with peptides are, the specificity of the peptides compared to so many other traditional medications where you have these unwanted side effects. They may be doing what they're, needed to be done, but they're also causing a lot of other, some other dirty side effects that you don't want. And these peptides are so specific to different receptors or different metabolic cascades in the body that allows us to really target whether it's specific tissues, specific, like I said, specific pathways in the body to really, whether it's, as you mentioned with Lyme disease, with peptides that specifically just naturally boost our immune system with, natural killer cells, T cells, just really being able to kind of target, those pathogens or viral infections in the body naturally, and allowing and even decreasing neural inflammation. So the specificity of the peptides with the minimal side effects and even drug interactions, these aren't metabolized through the liver or the kidney. So, drug interactions are not something that we are concerned about as well.
Well, that's an interesting point because so many are metabolized through very specific pathways that we're learning about, cytochrome 450, CYP2D19, all those amazing words we have to memorize. And someday it might even be malpractice not to know all that because it's pharmacogenetics. But we don't have to go, with this kind of peptide therapy, it's not going through there and losing its strength and then putting metabolites in a already compromised liver.
Yeah, exactly. And as you know, there's so many people that have different types of metabolisms, whether they have, they have a high metabolism of the cytochrome P450s or, so they metabolize certain drugs more so than others or complete opposite. So, the metabolism on a lot of our traditional medications plays a huge role. And that's kind of where you talk about pharmacogenomics, where you can kind of really see exactly what type of metabolizer each individual person is. But with the peptides, that's something that you don't have to be concerned about because they are short acting and they're metabolized, in the serum and the blood through different peptidases. But, they cause different metabolic cascades and can really make a difference in people's lives. And
here's where I want to make I'd like to make a point there. And that in our work, that short acting part is really a big deal because our people are so sensitive to a lot of these issues. As long as it's short acting, in general, I don't think there's any way we can do much damage. They just kind of get in there. They have a half-life of about 15 minutes. The CJC sometimes makes you a little red in the face and in cheeks, sure, and that's about it. But so it's very effective with not a lot of side effects.
Yeah, absolutely.
That's why it creates a chain reaction, helps restore the biology, that a lot of us have lost due to chronic illness.
Yeah, absolutely. And most all these peptides, are found in one way or another in the body, or they are just fragments of larger proteins that are found in the body. So, we're just providing them in, higher concentrations to really, because as we age, just like hormones, a lot of hormones, it's the same way with peptides. They gradually decrease over time as we age. So if we can, kind of replenish some of these peptides or hormones, we can really, kind of get ahead of the game before you do get to that, have to worry about that sick care model and really optimize.
I'd like to take it even a step further and say, when we add the peptide, and we've used some of your oxytocin, so we're really talking about peptides and neurohormones. We're talking about concentrations of coenzymes and even growth factors in some cases. And so when we put those concentrations together in, that mixture together in high concentration, what you're saying is it activates a larger system. It has a rollout effect. It goes like journeying through the body.
Yeah, absolutely. And a lot of our peptides, as you know, have a lot of pleiotropic effects. So they have multiple effects that can benefit, people in a variety of different aspects. We have peptides that help with gut issues and healing the gut, which, when it comes to immune system is vital. especially with, the diets that we see all the time here in America. The diets is not with all the processed food. So healing that gut can be a huge benefit. But these same peptides that heal the gut, they can also help with neuroinflammation in the brain. They can help with typical aches and pains in the body with inflammation, anti-inflammatory, but also helping heal tendons and ligaments. So it's peptides like that anybody and everybody can honestly see a benefit from.
Mm-hmm. So are you speaking, let's go ahead and get a little bit specific then. Are you speaking about the one that says BPC 157? Is that what you're doing?
Yeah, so BPC. So it stands for body protection compound. So
Isn't that nice? That's really nice.
Yeah, it's very convenient. Yeah.
Oh.
So, and it sounds great. It sounds perfect for what it really is. It's, it's found naturally in our body as body protection compound as a larger protein. The BPC 157 is just a fragment of that protein, and its natural function in the body, its main function in the body naturally is healing the gut mucosa, helping with, stomach ulcers and things like that. So it's, we've had great results with that product and that peptide in people with, irritable bowel disease, ulcerative colitis, Crohn's, and like I said, just leaky gut, trying to heal the gut when you're dealing with, different types of inflammatory conditions and immune function. I mean, a lot of your immune cells and immune function, originates from the gut. So that's a good place to start that, and, to really get a good foundation with your immune system.
I think that foundation is really important. Of course, we're most of the people that come here or talk to me are functional medicine practitioners. I think it's going to be a big market for you guys. And what that does in functional medicine, we're looking to restore the function of the gut. And that is a derivative. It has peptides that are out of gastric juices. And we've been working for years with glutamines and aloes and things like that. But until you get this kind of soothed out and restated and restarted, I don't know that all those work to the level, because I think the world has changed. I think we've been under constant bombardment by changes in food, water, and air. And so it's not always an amazing thing just to take glutamine anymore. So when I started the business about 20 years ago, so my first lesson was, here's your hydrochloric acid and some magnesium. And then tomorrow we'll do glutalamine. We'll put in glutamine and aloe and whatever else is in there, usually arabinogalactin. So the point being is that whatever we did 10 years ago, it doesn't necessarily work because we're kind of getting disconnected, and the peptides kind of help us get reconnected. Would you say that's a fair statement?
Yeah, absolutely. And, and then again, with the nice thing with the peptide is you can pair them with a lot of other types of therapy that the patient has, had some success with, but they just need that extra boost that not many doctors really know about. And that's kind of what we're here for, is to try to really, extend our education and extend our, what we do and the knowledge of peptides out to everyone else, and, and see the benefits of the peptides. And, again, you can pair those with different types of, vitamins, coenzymes, or whatever treatment you may be trying to do to really benefit the best of the patient without going down that, polypharmacy route.
Right. And so the next phase there is that we're pairing, actually in our practice, more with other enzymes and peptides. And so we love this idea in the group that I serve, how we use thymosin. Now, we've used a lot of thymus along the way to boost the immune system with mixed results, but tell me more about thymosin as a peptide.
Yeah, so thymosin is another one that really, I think, majority of us, everybody could really benefit from being on, because thymosin alpha 1 is basically a peptide that stems from the thymus gland. But what it essentially does is providing some immune modulation and simply immune boosting. So thymosin alpha 1 is actually an FDA regulated or an FDA approved product under the trade name Zadaxin, and it's actually FDA approved for malignant melanoma, hepatitis B, and hepatitis C. So, it's one that has been used for a variety of different conditions, ranging from cancer as I mentioned, down to as simple as someone taking prophylactically with during the flu season. It's been commonly used in adjuncts for different vaccines, including the influenza, the Zostavax for shingles. People have used it to help build up the immune system and provide a better response. But also in our practice in the integrative, field that we work so much with, autoimmune diseases, Lyme disease, just providing that foundation, as I mentioned, increasing your T cells, your B cells, your natural killer cells, and really kind of shifting more towards that Th1 response, which is more cell-mediated response. And you compare that with, as I mentioned before, the BPC, where you can have some decrease neuroinflammation as well. So you really get some good cognitive and a really good kind of foundational cocktail right there with both peptides together.
Yes, you really do. And when we test them here, those are the two that are always the strongest. But now we can build even more. And so I call it the 3-peptide therapy. So I put something usually in the middle, and it's either cerebroliacin or it can be CJC 1295. And I got to tell you, both of those will light up the house. I mean, they make your brain work.
Yeah, absolutely. The cerebroliacin is one that we've probably had the most kind of miracle stories and feedback from different patients, because it is a very powerful and potent peptide in the neurodegenerative cognitive world. We had one a couple months ago where a multiple sclerosis patient called us herself, basically in tears, saying that she was on cerebroliacin and BPC for a month. She hadn't been able to walk and get out of her wheelchair for almost 4 months, and she was on the cerebroliacin BPC for a single month, and she was able to be up and walking on her own. And it was just, it's things like that, that just you can see how it really can change people's lives when she said, I've tried every, medication out there, and, and I don't know what exactly it is that that I've been taking the cerebroliacin, but, if there's anything I can do to help promote this, she said it's really changed my life. So it's things like that and stories like that you hear that, really makes everything better, knowing you're doing the right thing.
Yeah, it really does. And the reason it kind of fits into our model, we basically see almost everybody has a shift to the autoimmune environment. I mean, the landscape, they're mainly autoimmune or neuroimmune is what I'd prefer to say, from some provocative intrusion like a virus, a bacteria that has locked in a way that has altered the function of their organs. So the organs actually become enemies, and they can't recognize. They just think it's part of them, and it starts to unravel. So my question is this has been around for a long time. It's even before Australia, I would imagine. I think I see Russian research 40 years ago.
Yeah, absolutely. There's been research all over the world, really. But yeah, Russia has definitely, specifically on some of those nootropics, they've really kind of led the way, with the Cmax and C-Link. Of course, those are two very popular ones that I think you've kind of utilized as well, that have really been, but yeah, these have been around. Some peptides, have been around for, a decade or, a century going back,
yeah.
As far as the research goes.
Circling back around to Cmax and C-Link, we see so many kids with, and well, I'm not going to say kids because we don't really treat the young crowd anymore, but up in their teens and places like that, they either have really super concentration problems, and it seems like that Cmax kind of works with that.
Yeah, absolutely. The Cmax is great. They both work similarly, but they both kind of have their own little twist. So a lot of times they can be paired together, kind of alternating. But the Cmax is great when it comes to people, utilizing with, like you said, concentration, ADHD patients. We've had a couple, as you mentioned, teenagers or even in their 20s, get off of their ADHD medications, being able to switch over to the Cmax And they're also great, specifically the C-Link for, anxiety and depression as well.
Not like we've seen anybody with anxiety lately.
Not at all. No, we're
Not
all
at all.
very calm,
Yeah.
very
Yeah.
calm society.
Yeah, I watch TV every night and I never sense that,
No,
that anxiety anywhere. So anyway, okay, so I wonder, I just wanted our folks to know there's, up to about 45 people circling in and out at this point. And because I believe it is a new era for living well today, because this is what we've been looking for, because we've had 5,000 autistic kids, we had 3,000 vector-borne infection people, and there's a place where you just can't get them turned back on and restored. And one of the things we have honorably added to it is today my son is actually down in Alabama installing one of our biophotonic enclosed environments that really stimulate peptides, or actually stimulate the receptors that peptides can attach to. It's called, we create sensitive ligand environments. That means that, they become sticky, and so they'll stick to these cells. And one of the problems is if we really talk about the world, and we don't want to use a lot of medical terms, the world has become disconnected, and so have the cells. And so I think this, plus my biophotonic modulation, actually stimulates the recommunication of those cells, and we don't want any longer treat symptoms. We want to talk about systems and not symptoms anymore. So the big takeaway, let's go to a big takeaway. What are three things? So we got to see, before we say that, we got C-Max, C-Link, CJC. Now, I gave somebody that, and so everybody needs to know we do have a great infusion center here, so we IV them. So we combine some, NAD and some cerebroliacin, but I put the CJC in by IV, and they really got a pretty nice red cheek. Well, whole face turned red. So. So we love to do it by IV, and we see people coming alive. But so give us two or three takeaways about, well, first of all, tell us about CJC, because I think that's amazing. And what is it, and what it is used for?
Yeah, so really the CJC is, in the combination with ipamorelin, is really actually our #1 product. But essentially, so CJC 1295 is a growth hormone releasing hormone. So it basically hits a receptor on, the pituitary that stimulates our body's natural release of growth hormone. So as I mentioned at the beginning, our hormones and, different peptides gradually start to decline as we age. And that's why as we age, we start to feel more sluggish, more tired. We're not, we don't have the energy like we had whenever we were, in our 20s. So but the CJC is going to provide a natural release of the growth hormone. And that's going to help improve, quality of sleep. You're going to have a more deeper quality of sleep. So you're going to wake up feeling more restored the next morning. It's going to in turn give you more energy, but also help with lean muscle mass and fat reduction. And then when you pair that in the combination with a product like ipamorelin, it hits a separate receptor on the pituitary, just like the CJC, and they just work synergistically, and you get about a 5-fold, better effect when you use them in combination to really provide that growth hormone pulse and really get, it's just kind of like an overall well-being peptide. So that's why I think it's our #1 product, is just because people generally just feel better on it, and usually feel better on it pretty quickly. Mm-hmm. But yes, you do definitely get the majority of people definitely get some of that flushing effect to their face.
Just out of curiosity, because, again, we don't hurt anybody, but out of curiosity, her face turned stayed red for about an hour. That's the first time I'd seen that. How much is too much by a push? I need to know that, everybody. That's not for you.
Well, and to be honest, it's not one that's normally given IV either. So, but
wow, I just pioneered something then.
That's right. Yeah. So, a lot of them can be given IV, but that's one that I haven't really had too many people give it a shot. But as far as what is too much, I mean, essentially, even the sub-Q dose where we do about 10 units, you're going to continue to get a flush, but really with the CJC Epimorelin, you can't really overdose on it. That's kind of the nice thing is because it's all you're going to essentially saturate those receptors on the pituitary, and the rest is going to get, there's only so many receptors there that you can saturate. And once those are saturated, the rest is going to get, broken down just pretty quickly there in the serum.
So tell me what you think about the pituitary as maybe one of the major causes of one. We know it's chronic fatigue, but how about other things? By correcting this, what do you think we get back?
Yeah, I mean, again, I think it's, kind of optimizing those levels in general. And, as we age, it's not that the pituitary, it's not that our storage of growth hormone or in general, declines. It's just a release of that growth hormone. So it's just kind of keeping that pituitary, young. And as long as, knowing those specific dosing protocols and not, because, with growth hormone, obviously it can have a bad rap whenever it comes to, whether it's bodybuilders or, performance enhancing. So if you Google, you can see some really, really high doses. And it's something that, you can definitely, down regulate those receptors. So that's something that, over time we've, tried to kind of perfect, and that's kind of where our dosing protocols come from. And that's why, education on the, the doctor's end as well, on our part, is important to get those dosing protocols precise and correct, and, providing the best benefit for the patient as well.
Is there anything in preparation that you need to do to take these? I mean, do you need to detox ahead of time? Do you need to do any of these other issues, any of these wonderful functional medicine things that we all talk about?
Yeah, I mean, so it depends on, what your ultimate goal is.
Mm-hmm.
Obviously, when it comes to CJC Epimorelin, a lot of people take it for,
just to get back in the game.
Yeah, optimal living, and just to get that energy back and have that feeling young again. But obviously, if you're doing it for some additional weight loss and to really see the results and to really have the impact that you may want, it's not a magic peptide or anything like that. So you can't still just sit on the couch and the muscle's gonna build and the fat's gonna go away. So it's keeping an active and healthy lifestyle is always important. But as far as the other products, it's always, again, you go back to the gut health and immune system. So those two, I think, for most,
that's a good start. That's the great starting point.
Yeah, I think the BPC and thymosin alpha are two of the greatest starting points. And BPC even has been shown to upregulate some of our growth hormone receptors throughout the body. So it's always a good one. Some people do start it, first, and then kind of prepare, and then do the CJC Epimorelin to really get that full benefit.
Okay, so we're starting to come to the end. We'll ask a few questions if we can. So I do have, say, a young man, and the misconception would be that we're actually giving him growth hormone. We're not really giving him growth hormone. We're just
correct. Yeah, and so it's just, again, that's why it's nice to be able to stimulate your own natural release of growth hormone. Whereas, if you're giving yourself exogenous growth hormone, you're going to shut down that axis, so that negative feedback loop. So if you ever go off of that, exogenous growth hormone, your body it's going to lose its ability to really produce your own growth hormone. So with our peptides, it's much more natural approach, and it's not going to shut down any negative feedback loop or any negative axis. And this is one that you can continue to take, and if you go off of it for whatever reason, you're not going to really lose a step. And if anything, your kind of maintenance level is actually going to be even higher than before you actually started the CJC Epimorelin peptide.
I want you to tell them how we have to administer, because I don't want to have to be the one to tell them.
Yeah.
What's the most
Unfortunately, that's one of the biggest downfalls with the peptides, and that's something that we're I think more as we go along. There's different dosage forms and routes of administration are hopefully going to come to fruition. Yeah, majority of peptides are given subcutaneous injections. So, initially a lot of patients, have a lot of pushback and are very hesitant with giving themselves an injection. But honestly, once they get it and once they see the needle, how small it is, the insulin needle, and once you give it a shot, and especially once you start to see benefits, it's really not near as bad as what you would think. I mean, I would completely understand with IM injections, that's a whole nother beast, but the tiny insulin needles, 31 gauge needles,
they're really not much. They're really not much. I can even do it. So,
exactly.
So it's really quite interesting. You can do more than one peptide at a time, more than likely. And but we have developed, along with some other partners along the way, the iontophoresis patch, and we know that CJC works in there. Depends on the Dalton weight or the molecule of the substance, but it seems as if this ionic phoresis patch delivered over 2 hours is really an adequate way to do it. We've, in other pharmacological studies that we've done on other substances, I think it delivers about 70% of the dosage we'd like to have. So we've been doing CJC and some other things on a iontophoresis patch as well. So who's this for? I mean, because there's all of a sudden, again, I'm all the way back to helping women keep their hair, and beautiful and amazing. That's not what my job is. I mean, I'm really just a neurological guy. I don't know much about anything else. And so here we have people coming in, all of a sudden they go, oh, please get me that GHK or whatever it is. Please get me the foam to keep my hair in place. Is that real? I mean, is that wonderful?
Yeah, absolutely. We've actually, we're kind of getting towards the end. We actually did an IRB with some other doctors a couple months back with a combination of a couple different peptides. But we've seen some really amazing results with a combination of different peptides in both men and women. And, it's, as you said, the different peptides, specifically the GHK, is become really, really popular in the aesthetics and cosmetic world. And, some doctors, like you mentioned, it may not be their specialty, but, it's something that it's just kind of the stigma out there, especially with women. Everybody wants to look younger and, feel better and, prettier when they look at themselves. So it's an easy, it's an area where it's quickly growing and, everybody can kind of utilize it, but where the GHK has been commonly used in hair loss, but it's also been popularly used in cosmetics for wrinkles and skin tightening, elasticity, and we're even, you can utilize that, at local areas around the face. And we've seen, we've had really good anecdotal feedback on that as well. But as far as population goes, I mean, there is a peptide out there for just about any condition. If there's not one out there right now, I'm sure it's being studied and will, come out sooner
So
or later.
that's why you want to contact our office to come down to the point, because there are 7,000 peptides.
Yeah.
So we've created an idea that we have to re-stimulate certain systems because they're the center of the roadmap. Then they radiate out from all of other things, and that's why we're interested in doing it that way. So we only use about 10 peptides out of 7,000.
Yeah, and we have, we're coming out with a new peptide or 2 peptides at least every month. So we have about 50 peptides right now, that we currently deal with. So, it's definitely an exciting field. So I think the sky's the limit. And really, I really believe that, the peptides are kind of the future of medicine, the way they're going and the results that we're seeing and the doctors that are getting behind us.
Well, that's what we feel. That's why we're taking a big stand here. And over the next 5 weeks, we're introducing people that can help us provide the runway, the pathway, the ability to re-stimulate the body. And when we, again, put this concentration of proprietary peptide or personalized peptide into somebody's body, the reaction throughout the body is pretty amazing. And so, so we want to be there doing that work in the future, just like you do. So, because it really was kind of the key, because I've been a functional medicine practitioner 15 years. And right now, I'm not going to sell another probiotic until they get Jamie Lee Curtis off the TV and stop talking about probiotics for her wonderful intestine. So, so I'm not doing any of that anymore. I want the real thing. I got to get to the bottom. I woke up one day and said, you know, we're not moving the needle enough. And so that's and not that probiotics are bad. We have wonderful research coming out in the microbiome. So our next step is the microbiome from here. So what we do is we start with the peptides to turn the system back on. We try to improve the gut, but we don't take it the old way. We're looking at all the microbiome research. And how do you think genetics plays a role in peptides? I don't see it, but I was wondering if you had seen anything.
Yeah, so I haven't seen you know, much yet, just because, you know, with the peptides being so new. But I fully believe I've heard Ryan mention the genetics. So, you know, Ryan Smith, you know, is our vice president of business development. I don't know you've been able to speak with him, but as of right now, the genetic part hasn't been you know, fully researched yet on our end. But you know, I think it's absolutely, I think it will, you know, play a role. It's just when that time will come, I'm unsure yet.
So there's one good question coming in from a viewer. I think her name is my wife. How long do you have to take these? You know, some of them are pretty short programs, aren't they?
Yeah, absolutely. Yeah, it really just depends on, you know, the condition that you're dealing with. You know, we were just talking about hair loss. Unfortunately, hair loss is one of the longer term, you know, with hair loss, it is kind of a never ending battle, but, you know, we recommend a minimum of 3 months treatment with dealing with hair loss, because you know, you do have to be patient with the hair follicles, allowing them to grow, getting the blood flow to those hair follicles, decreasing inflammation along the scalp. But other conditions, you know, some of our repair peptides, repair and recovery, like the thymosin beta 4 and the BPC 157, you know, I have taken the thymosin beta 4 myself with a hamstring strain, and you know, I noticed I was essentially fully recovered within a week. So you know, depending on what your condition is, the repair and recovery products are you're going to notice pretty significantly quick. You know, the some of the nootropics, cerebral ison, it's not immediate on most parts, but some people, you know, really, again, it just kind of, it's very patient variable depending on the condition that you're trying to treat and the I guess your results or the goal that you're striving for. But many of the peptides you can, you know, I mean, we even have, you know, the PT 141 or the bremelanotide that can be taken as needed for sexual dysfunction. So you're gonna, you know, see results with that within, you know, it can be as quickly as, you know, 30 minutes.
Interesting. One of the big communities I've been involved in is interstitial cystitis, and I think I mentioned that earlier, or maybe I just was talking to you on the phone. Women's and their bladders, it's an interesting, you know, thing, because you know, there's a lot of bacteria and other harmful pathogens that transmigrate to the delivery system and makes urgency and things like that. Is there anything for interstitial cystitis that you're aware of? That one, there's one that
Pentosan?
Yeah, thank you.
Yeah. So Pentosan has been used. It's been given either IM or sub-Q, and people have seen, you know, some really good benefits with it. Typically, it's a like once a week injection, and we just, you know, we were doing a trial with another doctor with the GHK copper as a bladder, what am I trying to say? Where you can go, you know, go into the bladder.
Right.
Yeah. But yeah,
Yep.
but it was a GHK
bladder installation.
Yeah. So that was, so I know a doctor was, but that was literally last week, I believe. So, we haven't been able to get any anecdotal feedback on it yet. But
Okay.
yeah, I mean, interstitial cystitis is definitely a difficult one. But the pentosan we've seen some benefits with, and the GHK copper is another one that comes to mind.
So what I'd like to do and see if Julia, are you still monitoring, Julia, what's going on? Can you hear
Bladder
me?
irrigation. That's what I was trying to think of.
Oh, okay. Irrigation, yes. So Julia, if you have questions in the box, you can't.
We do have one question.
Okay.
Let's see.
Can't tell that Julia's over here to my right, can you?
Yeah. I got to meet her earlier.
Oh, good. She's amazing.
Thanks, guys. Sybil asked, Sybil Gibson. Let's see. What are possible side effects?
Well, we discussed the possible side effects, but Sybil's asking side effects. If it's the same Sybil that I know, she really is very sensitive to everything. So how do you handle a sensitive patient, and are there side effects to a Lyme type patient?
Yeah, so for the majority of the peptides, the side effect profile is very, very minimal. There is always a chance, for, some type of, IgE response where, the body recognizes it as a foreign body, but it's it's significantly lower than traditional medicine. But you mentioned Lyme disease, where thymosin alpha is commonly used. Thymosin alpha in the studies actually had less side effects than placebo. So the placebo actually had more side effects than the actual peptide itself. So it is probably that and the BPC 157 are our two most benign peptides. So the side effect profile, again, for those specifically are very, very minimal. But the peptides in general is very, as far as side effects go, there are some like the PT 141 where, nausea can be detrimental for some patients.
Well, in Lyme, we're always talking about Herxheimer reaction.
Yeah.
So, but I don't think that's what happens here. I think it's a restoration or it's not,
Yeah.
And so in the BP 157, in the difficult case, I really am I'm just doing one pill a day, 15 days, and that's the first one I haven't had tremendous success with. So I think you and I talked earlier, and we're going to go up to 3 capsules a day.
Yeah, absolutely. Yeah, I mean the doses on the BPC you can really push. I mean, I've seen injections wise where they go pretty significantly high, and even in the studies they did not find a toxic dose on the BPC. So it's something that 3 capsules a day would be no issue at all.
So we've in the IV clinic we've pushed a lot of cerebral lysin and BPC at once. So
yeah, absolutely.
Good to know. I probably shouldn't put the CJC in there.
Yeah. Yeah, you may not get as severe as a flush if you do it.
Yeah, I'll just do it sub-Q. So a home program should be relatively easy. Sometimes they just last 30 days. We rotate. Is there anything else you want to add to that?
Yeah, for the majority of the time, you can just do a month, whether you're just trying to kind of restore the gut or restore the immune system, do a month of the BPC or a month of the thymosin alpha. But then there's products like CJC Ipamorelin where, after that month, you notice that you just feel, I kind of optimized, I guess, you just feel better where you have energy, you're sleeping better. That's one that you can continue on. Like I said, our protocol is that 5 days on, 2 days off. So typically people will do that Monday through Friday, doing that at bedtime on an empty stomach, typically at least 90 minutes after your last meal. But those 2 days off a week kind of, takes advantage of that break, I guess you can say, and prevent any kind of down regulation like I mentioned earlier.
So do we have any more questions for Blake out of the group?
Yeah. One from Joel. Can you talk about Apitope and it being tested as a potential MS vaccine? And are there myelin producing peptides?
Are there myelin producing peptides, and what about Apitope for MS?
So I'm not completely familiar with the vaccine for MS, but as far as peptides go, we do have, as I mentioned, the cerebrolizin. There are some studies that show that it has been shown to have some potential to regrow some of that myelin that's been damaged in the multiple sclerosis patients. As I mentioned earlier, we had that great success story with a multiple sclerosis lady who hadn't been able to walk for a couple months and utilized the cerebrolizin with a couple other peptides and was up walking.
The mechanism of action of that is really neurotropic factors, most likely, or
yeah, it's very, very pleiotropic.
brain-derived.
But yeah, it helps with increase in BDNF. It increases the nerve growth factors in the brain. Helps with forming synapse formation, specifically in different TBI patients. And then just an oxidative stress. It's a great antioxidant in the brain, as those neurodegenerative conditions can be pretty inflammatory and have a lot of oxidative stress on them as well.
Mm-hmm. So we're coming to the end. If we don't have any more questions, we probably have one or two more. But the most important question here again, my wife is asking, can we take it with C-Link?
Which one?
Cerebrolizin and C-Link together. Is that too much?
Absolutely.
Yeah, okay. Yep. It's right. Okay. So as we come to an end, what's the takeaway for all these people that are listening tonight? What do you think? And unless we have one more question. Nope. Okay. So what's the takeaway? Thank you so much for doing this. It's been a great pleasure for me to, Blake has been a great teacher, and I've been really, really happy to be associated with him. It's been amazing. So
yeah, no, thanks for having me. It's it's an honor to be able to kind of help and spread the word. And and I think that the takeaway is just as far as peptides in general. Like I said, I really believe that, and everybody here believes that the peptides are the future of medicine. It's people come to us after there's nothing. They've tried everything else. And we kind of provide a lot of products that that's kind of cutting edge. But the benefit is the sky's the limit, but really very minimal risk. But it's something where whether you have a condition going on currently, or you're just trying to kind of get ahead of the game and really optimize your life, I think there's the peptides are a great tool for any and everyone. And unfortunately, and once you try the sub-Q injections, it's it's really not that bad. But yeah, especially if you got someone like Dr. Payne, who's coming up with these patches, it's that makes it way easier and way more convenient, especially when you can get a couple peptides on one. Because you can take 10 peptides together, but you're going to start to feel like a pincushion once you're injecting yourself 10 times. But
we do three peptides in the iontophoresis patch, and for what people don't know, it's almost like an IV because it's a battery powered patch.
Yeah, and that's awesome.
Yeah, so we do up to 3 in a patch, and we've seen really decent results. Yeah. So I'd like to thank everybody for attending tonight, and my most interesting piece about this really is that I want you all to call probably Julia if she'll take those phone calls. So my best assistant Julia, and would love for you to call and check in and see if you want to be a part of this. If you have more questions, email them tomorrow and we'll answer them. And if you need an appointment, please talk again to Julia. So we're looking forward to serving you at any time here, and I look forward to having Blake as continue to educate me on all this amazing development in what is called peptides. Thank you all very much, and we look forward to serving you in the near future. Thank you, Blake.
Yep, no problem. Thank you.
Yep.